Hi, I'm Jen. I'm the wound nurse here. I want to talk about pressure injury prevention. So the first area that we're going to talk about is the Braden score and scoring the sensory. You want to make sure you're thinking about things like, does your patient have peripheral neuropathy? Have they had a nerve block, or have they had an epidural? We're pretty good with paraplegics and quadriplegics because we do think about that. But the other ones we might not always think about. We've had some pressure injuries at our facility, and one of those, a patient did have a nerve block, and she did end up developing a pressure injury. So please make sure you take that into consideration when you're scoring your Braden. Skin assessments, of course, are very important, not only for the patient that I just talked about, but this particular patient had a below the knee amputation and had a device on a knee immobilizer on, and the strap was going directly across his patella. Developed a deep tissue injury from that. So we want to make sure that we are checking all devices, and not just orthopedic devices, but even devices with the ears, on the face, sequential compression devices, anything that the patient might have or be laying on, like if they have their IV tubing or a Foley catheter, making sure that they're not laying on that tubing. So checking all devices. And then the next section that I want to talk about is turn team. A lot of times it has to do with your approach in turn team to make sure that we can get these patients turned. You don't want to say, hey, do you want to turn? Because a lot of people are going to say no. Of course they don't want to turn. Maybe they have pain, like this particular patient. So instead, maybe saying, hey, it's time to turn, and then you can give them a choice. Do you want to go right or left? But a choice that you like and can live with. So we can make sure we are turning these patients on a regular basis to prevent pressure injuries. The other piece of that is making sure, since you're the turn team, making sure the other nurses are aware that turn team got done and that your patient, one of your patients or two may have refused. So a quick little secure chat that turn team got completed and room 34 refused. That way the nurse is aware. If your patient, if you do find a hospital acquired pressure injury, there's some things to do. Make sure that you are taking care of the patient and doing things that they need for their injury. You're getting those implemented. Notify the physician, take a photo, put in a pressure injury LDA, consult the wound nurse, and put in an incident report. So if you all have any questions at all, you can reach out to me. Thank you very much.